Okay, so in the last video we talked about provider contracting, and in this video we're going to talk about the health insurance plan design as it relates to networks. When you purchase a health insurance policy from an insurance company, they will usually give you a bunch of printed material that will tell you how your benefit plan works, and a lot of times they'll call that some of that printed material the member payment summary. There's a uniform document now under Obamacare that I personally don't think is very articulate. It's called the Summary of Benefits and Coverage. But what this form does is it outlines at a very high level what your benefit plan looks like. And so you'll have one of two types of health insurance policies. You'll either have a health insurance policy that has in-network coverage only, or you'll have a policy that has in-network coverage and out-of-network coverage. And all that really means is that either you have a policy that says you can only go see network providers, and if you go see out-of-network providers, such as in this case here, then there is no coverage. The out-of-network providers, it would be like having no insurance. If you go see in-network providers, then it's insurance as you're used to. The other types of policies will allow for in-network and out-of-network coverage. So they'll say you can go see network providers and out-of-network providers, but we're going to treat the policies differently. So to just give you kind of an overview of how that might work, if you had a policy that had in-network coverage only, and we'll try and make these policies almost identical, you'd say, okay, I've got a $500 deductible, and maybe I've got co-insurance of 80/20, and then an out-of-pocket maximum of 5,500, 5,500. So what the policy would say is, in this case, if you had a policy that had in-network coverage only, if you go see one of our network providers, these are your benefits. And usually this benefit category would include these items, but it usually would include up to 25, 30, sometimes even 40 benefit categories. It would include what are the copays for a physician's visit? What's the copay if you go see a specialist? What would be the mental health benefits? What's an inpatient hospitalization? What are the pharmacy benefits? I mean, it's a very extensive, list of benefits, usually 1 to 2 pages long, and then you go down this column here where it says, here's your network benefit, and it'll tell you exactly how the health insurance policy works. But it's pretty straightforward. If you have a policy that has in-network coverage only, you have insurance when you go in-network. You have no insurance when you go out-of-network. So it's obviously there's obviously some risk involved. The easiest way to find out if your policy has out-of-network coverage is to either refer to the printed material, contact the health insurance company, contact your insurance agent. If you're getting your health insurance through work, you may want to contact your HR administrator or your plan administrator, whoever. But where things get interesting is when you're dealing with a health insurance policy that covers both in-network and out-of-network providers. So there's a couple of things to note. One is that the benefit levels for in-network services and out-of-network services are usually different. So following the previous example, if you had a policy that allowed for out-of-network coverage, the in-network coverage is going to be the same as it would be with the prior plan. So you'd say I've got a $500 deductible still. I've got 80/20 coinsurance, meaning that the health plan would pay 80% of my medical expenses after the deductible. I would pay 20%, and then the out-of-pocket maximum would be something in the neighborhood of 5,500. However, what the health insurance plan says is that, look, we really want to encourage you to use our in-network providers. We went to a lot of effort to enter into contracts with them. Our ability to be competitive in the contracts we form with them depends on us, directing people to access their services. So we'll still offer you coverage if you go see a provider out of network, but we're going to offer reduced coverage. And so they might say, usually it's not a perfect rule, but as a general rule of thumb, you double your deductible. It seems like they always pair an 80/20 coinsurance for in-network with a 60/40 coinsurance out-of-network. So they'd say that for out-of-network services, you'd have a deductible of $1,000. You would have coinsurance of 60% paid by the health plan, 40% paid by you. and then for your out-of-pocket maximum, you might be looking at double again, 11,000. I'm actually seeing them go a lot higher now, but we'll just use this for illustration's sake. So the point is, the health insurance company says we're going to give you two different benefits. It's like having two different insurance policies. One insurance policy for network providers, one insurance policy for out-of-network providers. So a couple of things to note here. One is that there are different benefit levels for out-of-network providers. Another thing to note is that oftentimes what happens is when you look at these forms, when you've got the out-of-network benefit, you're usually going to see that little asterisk next to each of the benefit categories on the out-of-network benefits. And we're kind of used to now there's always the fine print in anything we do. They'll have the footnote section down here, and then in the really small print it'll refer to the asterisk and tell you, hey, balance billing may apply. What that means is this. If you remember from the last video, we talked about medical providers. If you go and see a in-network provider, the insurance company negotiated a lower price for those network providers. However, the out-of-network providers can charge their own prices. The insurance company, whether you go in-network or out-of-network, will usually only pay their benefits against the negotiated price. Meaning that if your health insurance or if your medical provider charges a price higher than the negotiated amount, your health insurance company will pay you the reduced benefit still against their contracted price, and then they'll allow the medical provider to bill you the difference. Which means that essentially out-of-network benefits can be, to put it frankly, they can be dangerous. So the other thing to note on out-of-network benefits is that balance billing applies. And then the third thing to note that's not obvious here is that the accounting for in-network and out-of-network benefits is separate. And what I mean by that is this. If you said, okay, look, I'm going to go get some services done in-network and some services done out-of-network, your health insurance company will actually keep separate accounts. They won't combine your deductibles. They won't say that, hey, we'll add your in-network deductible to your out-of-network deductible. They'll start your in-network deductible at 0, and for all your in-network services, they'll accrue that accounting-wise to your in-network benefit, and they'll accrue your out-of-network services to your out-of-network benefit. So in theory, in a worst-case scenario, if you started mix-matching your benefits, you could be subject to one out-of-pocket maximum of $5,500 plus another one of $11,000 plus the balance billing. So key things to note is that there's different benefit levels for in-network and out-of-network services if your plan allows for an out-of-network provision. Balance billing applies to out-of-network services only, and the balance billing applies to the member. The health insurance plan will only pay their negotiated contract rate whether you go in-network or out-of-network, and then the accounting for the in-network and out-of-network services is separate. So that wraps up health plan design for networks, and then in the next video I'm going to actually kind of walk through sort of an example.